Welcome back to my channel. If you're new here, my name is Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone! Kumusta ang weekend nyo? How was your weekend? And yes, today is another Monday and we're gonna have another lecture discussion for today. Like scheduled. As scheduled, right? So every Monday, Wednesday, and Friday nga po tayo nag-upload ng ating online classroom discussion. And for today, like you see on the title, like you are seeing on your screen, today is all about your nursing procedure and skills, IV insulin administration, your ultimate nursing study guide. Ngayon, kung hindi mo pa napapanood yung other nursing procedure and skills video, lecture materials I created under my channel, I'm going to put the playlist link on the description box, or whenever the icon button pops out, click the one out because I'll be putting it there together with the other playlist I have on my channel. You guys, I have tons, hundreds and hundreds of nursing educational videos for you. Please check them out, use them for your advantage, make your life easier. I want this channel to be your ultimate go-to channel for nursing reference, guide, facts, updates, knowledge, all of that good stuff. Okie doke. So before I further proceed, I would just like to also grab this opportunity to thank everybody who's watching right now for coming in and showing in to class. You guys are amazing. You've been very, very diligent students. I love you guys to the moon and back. Thank you so much for all your love and support. I've been receiving a lot of comments, emails, likes, and tags from all of you guys saying how much you love and appreciate my contents. And nakakataba nga po ng puso. It's so fulfilling on my end. You guys, thank you very much. I would just like to let you know that I actually check our analytics for this month, and I've noticed that 57% or more than 57% of the people who are watching my channels are actually non-subscribers, meaning the remaining were like subscribers, like avid subscriber of the show. The rest are just like watchers. So this is all for you guys. I really wanna ask for your help and reach that 20,000 mark. If you will be able to, if you're watching right now and you're not yet subscribed and you're not hitting that notification bell, come on, you gotta give me that subscribe button, because if you find meaning to my uploads and you find my uploads really helpful and it helps you, why are you not subscribing? I mean, I'm doing this for free for all of you guys. The least thing that you can do is to show me support and love, right? Oh my God. I was just saying, I'm really, hoping that you guys can support me in growing this channel. The bigger the channel grows, the bigger the content is going to be. We don't know, like probably in the upcoming uploads, we're going to invite experts on the channel discussing about, some nursing trends and nursing research. I don't know. That could be one, but none of that will happen if we're not going to make this channel grow and then we're not going to make this channel as popular as it could be. You know what I mean? So, you know what to do. You keep on sharing my channel. You're gonna start hitting that subscribe button and that notification bell so that every time I upload, you are going to be notified. All right. So yes, like I said, this is all about IV infusion administration, and this will be your ultimate study guide sa pag-aaral mo and how are you going to administer insulin through IV, intravenous. So let me share to you the objectives for our today's discussion. All right. So these are the main focus of our today's lecture. We're going to have an introduction of your IV insulin, the equipment and preparation that you need to do and you need to have in, administration of IV insulin. We're gonna discuss the implementation process, special consideration, complication, and of course, documentation. O diba? What did I tell you? This is going to be a deep dive, a thorough step-by-step what's this? Step-by-step guide in IV insulin infusion administration. Now, before I further proceed with the introduction, I would just like to give you time to subscribe and hit that notification bell. Do it now. Go. Thank you so much for doing that. Diba ang saya? Ang dali lang, diba? It's so easy. It doesn't really take you time to do it. Like literally less than 5 seconds. Don't be lazy. Come on. All right, so let me share to you the introduction. Now, because hyperglycemia and hypoglycemia are linked with adverse outcomes, including death, goals for caring for patients with diabetes would include preventing both extremes. Other goals include promoting short, safe hospitalization and care transitions that prevent complications and readmission because of the same condition. Now, critical care patients are at risk for stress-induced hyperglycemia from such factors as increased cortisol levels, glucogenesis, and glycogenolysis, which can result in higher incidence of adverse outcomes, including infection. These patients can benefit from IV infusion therapy. Regular insulin is the only type of insulin that can be administered IV. Malino ba yon? Malinaw na. Furthermore, let me give you an additional information in terms of introduction. The American Diabetes Association currently recommends initiating therapy for persistent hyperglycemia when a patient's blood glucose level rises to 180 milligrams per deciliter, o yung 10 mmol per liter or above. After insulin therapy begins, the American Diabetes Association recommends a target blood glucose range of 140 to 180 milligrams per deciliter. For most patients, some critical ill patients may benefit from more stringent goals such as maintaining glucose levels between 110 to 140 milligrams per deciliter, as long as such goals can be reached without significant hypoglycemia. In the critical care setting, continuous IV infusion is the best method for achieving glycemic targets. Yes, may mga kanya-kanya nga pong ICU tinatawag sa facility namin, ICU protocol or insulin protocol, mga ganon. Kung meron kayo noon sa facility nyo, comment it down below, share it to others. Now, the insulin should be administered using validated protocols that allow for predefined infusion rate adjustments that are based on the patient's blood glucose levels and insulin dose. Meron din tayong tinatawag na sterile no-touch technique should be used when administering IV infusion or IV insulin to reduce the risk for vascular catheter-associated infection. Scrubbing the hub. That's what it is. Now, sa kagaya ng sinabi ko sa inyo, ma-share ko lang, on our facility, in my facility, we have a step 1 ICU protocol, insulin protocol, or step 2. That means every hour, depending on the amount of the sugar level of the patient, you will adjust the infusion rate of your insulin. Don't worry, because on the later part of this lecture, you'll be able to have a full grasp and full knowledge. You'll be fully knowledgeable when it comes to your IV infusion of your insulin. All right? So malino ba tayo dito? Everything clear? Very good. Let's proceed. Equipment and preparation. So preparation of equipment, inspect all IV equipment and supplies. If product is expired, alam nyo naman, if defective or has compromised integrity, remove it from patient use. Label it as expired or defective and report the expiration or defect as directed by your facility. Parte ng successful nursing intervention, preparation. Preparation is the key to success in everything. So we want to make sure that you gather all the equipments that you have, including checking the integrity. If your infusion pump, if your infusion plum is expired, or the medication itself is expired or defective, you want to replace that with a new one that is working. All right. On the next slide, I'm going to give you the actual equipments that you need to use in preparing your insulin infusion. All right, eto na tayo. So, In terms of equipment, you need to have your patient's medication administration record, yung drug chart ng pasyente mo. That's what it is. Pre-mixed bag of regular insulin solution, typically 1 unit of insulin per 1 ml of diluent. In our facility, it's the pharmacy the inpatient pharmacy who will be able to, who create or who will mix the medication. Depende kapag initial rate or stat or urgent. Because sa ICU, ginagawa namin, we are the one preparing it. Depende sa order ng doktor. Now, 10 ml pre-filled syringe or a syringe designed to generate lower injection pressure containing preservative-free normal saline solution. IV administration set. Kung magamit ka ng, sa facility nyo ng infusion pump, you need infusion plumb set. Alright? Labels, very important. Kailangan mo dyan ng demographics ng pasyente mo. Kailangan mo rin dyan ng high alert labels. And of course, labels doon sa infusion pump, labels sa expiration ng tubings. Depende pa rin yun sa facility nyo kung every 4 days, every 1 day, mga ganon. Or 7 days. Electronic infusion device, preferably a smart pump with dose error reduction software and interoperability with electric health records. Ito yung tinatawag nating infusion pump. 'Di ba? Kung hindi ka pa aware sa infusion pump, huwag ka mag-alala kasi gagawa ako ng lecture material regarding sa infusion pump. Sa Pilipinas kasi, lalo sa mga public, hindi ko alam pero nung panahon ko, wala kaming infusion pump. KVO rate, orasan mo talaga 1 full minute. 'Di ba? Sa'yo. Tagang 1 full minute mo siya kung ilan yung drop rate na gusto mo ba? 20 drops per minute. 20 GTTS per minute. O, diba? Alam natin yan, 1 full minute tayo. Pero ngayon, mas safer kasi ang paggamit ng infusion pump. And it is very, very recommended. It's most facilities nowadays are using infusion pump. Now, gloves, sterile gloves or clean gloves. Now, antiseptic pads, chlorhexidine-based, povidone iodine, or alcohol swabs. Para sa pagdidisinfect mo ng line and pagdidisinfect mo ng whatever it is that you need to disinfect. Blood glucose monitor, very important. And your single-use auto-disabling finger stick device. Intake and output monitoring equipment. Okay? Intake and output, sa amin, meron kami ditong parang sheet na minomonitor namin yung INO, yung every hour, ilan yung pumapasok na IV fluids or infusion or insulin sa pasyente. Kung may adjustments, makikita mo dun. Alright, once again, these are the one more time. Well, lastly, we have your optional equipment. We have your venipuncture equipment, IV catheter, insertion equipment kung wala pang linya ang pasyente. Peripheral man ito. Okay? Peripheral, kung may central line, mas maigi kung may central line. Alright? So once again, these are the equipments. Proceed na tayo sa implementation. Ito Toro ito. So from start to finish. Ready ka na ba? Hinga-hinga. Bago tayo mag-proceed, mag-subscribe ko muna. Go! O, diba? Ang bilis lang. O, eto na tayo sa implementation. Like I said, this is going to be the thorough and step-by-step implementation process ng iyong IV infusion ng insulin. Okay, so hinga ng malalim, deep breath. Here we go. First stop, collaborate with a multidisciplinary team to determine the patient's risks and benefits associated with IV insulin therapy. Verify mo kung may order ba talaga. Is there really an indication? Or what are the contraindications? Doktor, dietitian, all of that. Alright, next, avoid distractions and interruptions when preparing and administering medication to prevent medication errors. Single independent preparation or double checking po ang ginagamit natin because insulin is one of the high alert medications. Okay, alright. Next, review the practitioner's orders order to make sure that the prescribed infusion solution or medication, dose rate, and route of administration are appropriate for the patient's age, condition, and access device that can or that the infusion or medication is compatible with other solutions or medications. Make sure that the order includes any tests results that require monitoring. Address concerns about the order with the practitioner, the pharmacist, your supervisor, the risk management department, or as directed by your facility. Next, reconcile the patient's medication at each care transition and when the practitioner prescribes a new medication to reduce the risk of medication errors, including omissions, duplications, dosing errors, and drug interactions. Next, check the patient's medical record for an allergy or contraindication for or to the prescribed medication. If one exists, don't administer the medication. Notify the practitioner or your doctor immediately. Gather and prepare the necessary equipment and supplies. Alam mo na yung supplies natin kanina. We already discussed that. So, ito na yon. Gather ka na. Compare the medication label on the insulin solution bag with the order in the patient's medical record. Check the expiration date on the insulin infusion solution bag. If the medication is expired, return it to the pharmacy and obtain new medications. Last one, visually inspect the solution for particles, discoloration, and other signs of loss of integrity. Don't administer the solution if integrity is compromised. Normally, ang color ng insulin natin is white. So, kapag napansin mo na nagbago yung kulay, naging yellowish, may mga particles, may mga, particles na mumuo-muo, yung mga ganon, or even dun sa packaging, if there's break or it's already open, kapag ikaw nagpe-prepare nito, don't use it. Use another one or return it to the pharmacy. Alright? Continuation pa rin to ng ating implementation. What's the next thing that you're gonna do? Perform hand hygiene. Very important to prevent the spread of nosocomial infection. Confirm the patient's identity using at least 2 patient identifiers. In your facility, depende ito ha. Sa facility namin, general naman na ina-identify ang patient kapag conscious. You will ask your patients what's their full name. And then may ID band. Sa mga unconscious, ID band. Yung full name, tsaka what's this? MRN o yung patient ID number. Alright. Tsaka double independent checking ito sa pag-a-administer ng gamot. Kailangan meron ka pang isang licensed nurse. What else? Provide privacy. Explain the procedure to the patient and family if appropriate according to their individual communication and learning needs to increase their understanding, allay their fears, and enhance cooperation. Raise the bed to waist level before providing care to prevent caregiver back strain. ROM po ito. Okay? Next, perform hand hygiene o maghuhugas ka ulit ng kamay. Put on gloves to comply with standard precautions. Standard precaution po, kapag sa mga kapag mga walang isolation, precaution ang pasyente. Bawa, standard lang naman ang pasyente, wala naman siyang known infection. So, standard precaution lang tayo. Gloves, and of course, sa hospital, you will wear your mask. Pero kapag mga contact yan, kailangan nakagown, yung mga ganun. Especially when you're going to touch the patient surrounding, you're actually touching the patient. Alright, so clinical alert. Listen, don't share finger stick lancing o yung mga lantos natin, lancets, needles, or meters to reduce the transmission of bloodborne diseases. Kapag Hep B, ang mga pasyente mo may HIV, hindi mo, single use lang to ha. Tapon agad. At hindi mo rin siya pwedeng gamitin sa other patients. Sasapukin kita. Shared lancing devices carry the same risks as shared needles and syringes. Last one for this slide, obtain a finger stick blood glucose level to ensure that insulin infusion is started at the appropriate dosage. Malinaw ba yon? Malinaw. Very straightforward and very detailed ito. Kaya huwag ka na masyadong dyan. Next. Alright, nakakahinga pa ba? Nakakahinga pa, absolutely. Huwag mag-alala kasi if you're watching this video on YouTube, I'm gonna be dividing it into chapters. So kung may gusto kang balikan sa implementation, sa special consideration, it will be easier for you. Nakakahiya naman kasi sa'yo, hindi ba? Eto na. Next, if the patient is receiving the medication for the first time, teach the patient and family, if appropriate, about potential adverse reaction and discuss other concerns related to the medication. Later on in this discussion, we're going to discuss about the effects or special considerations, okay, or complications of your IV insulin infusion. Next one, verify the medication is being administered at proper time in the prescribed dose and by the correct route to reduce the risk of medication errors. If your facility uses barcode technology, which is the one we're using, use it as directed by your facility. Barcode, meaning iba-barcode mo yung actual medication. Meron kasi yan nakalink sa computer system. Or even yung pag-check ng sugar checking, piniprint out yung barcode, identify sa patient side, and then you're gonna scan it para ma-avoid yung patient misidentification ng pasyente. Diba? Saya. Spike the insulin infusion solution bag and spike the administration set tubing. Meaning, spike, huwag makakabahan. Tutusukin mo lang naman ng plum set. Di ba mayroon yung tusok? Yun na yun. Kasi magsa-start ka na, huwag ka masyadong spike dyan. Huwag kang kabahan sa spike na yan. Madali lang yan. Next, label the administration set with the date of initiation or the date when a change is required as directed by your facility. Very important po ang labeling, lalo na kapag Christmas tree ang infusion ng pasyente mo. Paano kapag wala ka sa area mo, nag-lunch ka, tapos yung kapalit mo, pinakasuyo mo sa katrabaho mo. Tapos hindi niya alam, wala mga proper labeling. Ikaw as a bedside nurse, alam mo kung ano yung mga ongoing. Pero yung kasunod, hindi niya alam. Di na-hook mo na. Imbis na dahil lang sugar level ng pasyente mo, bago ka mag-lunch is very normal, in-stop mo yung ongoing infusion rate. According sa protocol nyo sa hospital, kumain ka. Tapos nag-ring yung alarm, nag-bed alarm yung o kaya nagtawag yung pasyente, nag-ring yung infusion pump. Hinok nga yung Hoy, nangyayari ito ha, makinig na mabuti. This is from real life experience. Hinok ngayon yung insulin. Pagbalik mo, hypoglycemia na yung pasyente mo, gigigil ako sa'yo na pa D50 ka pa tuloy. Yung mga ganon. So, very important, very common sense na lagyan mo siya ng proper labeling. Standard operating procedure po ng facility nyo, you have to follow. So, you must be aware about that. Okay? Huwag matigas ang ulo. Don't be stubborn. Now, program the electronic infusion device with the name, concentration, and volume of the insulin. Use an electric infusion device for infusion that requires precise flow control to maintain patient safety. Consider the use of smart pump with dose error reduction software and interoperability with electric health records to reduce the risk of infusion-related medication errors. Make sure that alarm limits are set appropriately and that the alarms are turned on, functioning properly, and audible to staff. Infusion pump ito. So, infusion pump, meron dong part na choose medication. Hindi po pwedeng walang insulin na nakalagay doon. May program doon na naka-insulin. So, mamimili ka kung units per hour kasi itang insulin. Units per hour, ilalagay mo doon ilan yung volume, ilan yung strength na medication. Magtanong ka, kalikutin mo yung infusion pump nyo para maging aware ka. The next time na magkakaroon ka ng pasyente na may naka-insulin o may order ng insulin infusion, you know already how to do it, okay? Alright, and very important na you listen to your infusion alarms. Kaya nga nag-a-alarm, meaning kasi kailangan ng attention mo. And para ma-prevent din natin yung medication error related to infusion pump, ongoing infusion medication. Alright, kaya safe talaga ang mga infusion pump. Next, if a disinfectant containing end cap is covering the catheter hub, remove and discard it. Perform a vigorous mechanical scrub of the IV catheter hub for at least 5 seconds using an antiseptic pad. Allow it to dry completely. Recommended 5 seconds. Scrub the hub vigorously. Huwag kang pabebe sa pag-scrub ng hub, okay? Para ma-avoid ang catheter-related infection. Alright? Next, while maintaining sterility of the syringe tip, attach a pre-filled 10 ml syringe or a syringe specifically designed to generate lower injection pressure containing preservative-free normal saline solution to the needleless connector, yung tinatawag nating microclip. Unclump the catheter and aspirate slowly for a blood return that's the color consistency of whole blood. If you don't obtain blood return, take steps to locate an external cause of obstruction. Insert a new IV catheter if necessary. Flushing lang ito before you start. Flushing ito ng peripheral line mo kung naka-peripheral. I-check mo muna yung patency na syempre ng peripheral line mo para maiwasan mo yung extravasation. Baka naman hindi na in yung IV line mo, nag-start ka ng infusion, di na yan, gigigil ako sa'yo. Kaya, flush mo muna kapag walang resistance, walang backflow, walang bulgy, ay may backflow naman, ibig sabihin, in ka pa. So, go mo na ang iyong infusion. Nakakarami na ako sa implementation. Baka naman mag-subscribe ka muna, go. Thank you so much for doing that. Let's proceed. All right. So, if you obtain a blood return, inject preservative-free normal saline solution slowly into the catheter. Use a minimum volume of twice the internal volume of the catheter syringe. Don't forcibly flush the device. Further evaluate the device if you meet resistance. Perform vigorous mechanical scrub of the IV catheter hub for at least 5 seconds during an antiseptic pad. Allow it to dry completely. Connect the IV administration tubing to the patient's IV access device. Trace the IV tubing from the patient to the patient of origin to make sure that your connecting tube to the proper port. Route the tubing in standardized direction if the patient has other tubing and catheters having different purposes. Label the tubing at both the distal, near the patient connection, and proximal. Important to. Ends to reduce the risk for misconnection of multiple IV line will be used. Line reconciliation lang to. Yun. Okay? Clinical alert. Nako, na double click ko. Clinical alert. Insulin is considered high alert medication because it can cause significant patient harm when used in error. If required by your facility before beginning an insulin infusion, have another nurse perform, which is ginagawa namin to, perform an independent double check to verify the patient's identity and make sure that you have the correct medication in the prescribed strength or concentration. The medication's indication corresponds with the patient's diagnosis. The dosage calculations are correct and the dosing formula used to derive the final dose is correct. The prescribed route of administration is safe and proper for the patient. The prescribed time and frequency of administration are safe and proper for the patient. And if an infusion and pump setting are correct and the infusion line is attached to the correct port. Ako po, aminin ko sa inyo ha, I've been a nurse for almost a decade, but every time I'm handling not just insulin but any high alert medications, I don't care how long I've been working in the area, I'm still gonna do with double independent checking. Even though alam ko na, because 2 heads is better than 1. And always, there's something I've learned in my 10 years of nursing experience. Always do the right thing, even if there's no one is watching. Do the right thing. If you live your life in a purpose of truth, you can survive everything. You can survive even death. You know what I mean? So, always, listen to me when I say this. Do the right thing. All right? Yun na. Go. Next, after comparing the results of the independent double check with the other nurse, if required, unclamp the catheter and begin infusing the medication if there are discrepancies. If discrepancies exist, rectify them before administering the infusion. Recheck the IV catheter and monitor for signs of infiltration, extravasation. Depende, peripheral line sa facility namin every 4 hours. Central line every 1 hour. Nasa sa inyo po yun, nasa facility protocol nyo yan. Lagi nyong babasahin. Ang matigas ang ulo. Eto na. Check all the connections are secured to prevent leakage, bleeding, and contamination. Make sure that the infusion device's alarm limits are set appropriately and the alarms are turned on, functioning properly and audible to staff, meaning you can hear it. Huwag mo i-decrease yung volume. Nagwe-waste ka, humuhukagi moves ka eh. Ito na tayo. Next, return the bed to the lowest position to prevent falls and maintain patient safety. Anong sinabi ko sa inyo? Hindi ba deep dive ito, step by step? Huwag kang ano dyan. Next. Discard used supplies in appropriate receptacles. Infectious sa yellow. Ordinary waste sa black. or depende sa SOP nyo. Sharp box. Huwag nang matigas ang ulo. Remove and discard your gloves. Obtain finger stick blood glucose levels at regular interval as ordered. Blood glucose testing frequency ranges from every 30 minutes to every 2 hours. If the result of finger stick blood glucose measurement doesn't correlate with the patient's clinical status, confirm the blood glucose level with laboratory sample of plasma glucose as ordered or according to protocol. Titrate the infusion to maintain the target blood glucose level range as ordered. Titration po every hour, depende, every 2 hours, every 3 hours. Nasa SOP namin to. Depende sa sugar ng level mo, yung frequency ng pag-check mo. Tapos nakadepende din doon sa sugar level ng pasyente mo kung ilang units of insulin per hour ang ibibigay mo. So, i-check mo yon from time to time. Now, closely monitor the patient for signs and symptoms of hypoglycemia. The American Diabetes Association defines hypoglycemia or the glucose alert value as what? A blood glucose level of 70 milligrams per deciliter or less, and clinically significant hypoglycemia as blood glucose less than 54 milligrams per deciliter. Severe hypoglycemia has no specific glucose threshold and is defined as severe cognitive impairment requiring assistance from another person for recovery. Follow your facility's protocol and the patient's treatment plan for preventing and managing hypoglycemia. Very important po ito ha. Baka nasobrahan sa insulin mo, kukomatose yung pasyente mo, girl. Next, monitor intake and output as ordered to promptly detect fluid imbalances. Notify the practitioner promptly if imbalances occur. Monitor electrolyte levels as ordered to promptly detect electrolyte imbalances. Insulin brings potassium into the intracellular space along with glucose. Makinig. Increasing the risk for hypokalemia. So, sa mga pasyenteng naka-insulin infusion, they are high risk for hypokalemia. Makinig ha. Notify the practitioner of critical test results within the facility establishment timeframe so that the patient can be treated promptly. Madalas may mga routine lab sa mga pasyente naka-infusion, insulin infusion, mga electrolytes, VBG, or depende, ABG. Ang pasyente mo, serum potassium. Importante yon kasi they are high risk for hypokalemia. Kapag masyado mababa ang potassium, ano bang normal potassium mo? Serum potassium, 3.5 to 5.5. Kapag mas mababa doon sa 3.5, expect ka na ng correction. Okay? Perform hand hygiene. Document the procedure. Tapos na po tayo sa implementation. Ang haba, hindi ba? Kakahiya naman. O, eto na tayo sa special considerations. Hinga ng malalim. Naku, nangangalahating oras na nga pala tayo. Pero okay pa ba kayo dyan? Okay pa. Very good. O, i-like mo na tong video na to. Ang gigigil ako sa'yo. Bigyan mo na kita ng time to subscribe. Eto na. Inom lang ako ng kape. Go. Okie dokie. Alright, thank you so much for subscribing and hitting the notif bell. Ito na tayo sa iyong special considerations. Makinig na mabuti, nurses. So meaning, sa mga pasyenteng naka-infusion pump, here are the things that you have to be mindful of. Alright? So, the Joint Commission has issued a Sentinel event alert concerning medical device alarm safety because alarm-related events have been associated with permanent loss of function or death. Among the major contributing factors were improper alarm settings, alarm setting turned off inappropriately, and alarm signals that were inaudible to staff. Make sure that alarm limits are set appropriately and that alarms are turned on, functioning properly, and audible to staff. Follow facility guidelines for preventing alarm fatigue. Kaya ito, payo ko sa iyo, kung ikaw ay bago sa unit o bagong nurse at hindi nga first time mo makakita ng infusion pump, magtanong ka sa mga senior mo. Hindi katangahan ng pagtatanong. Okay? Actually, it is a sign that you are smart and you're willing to learn. Meron kang initiative, may eagerness to learn. Okay? Huwag mahihiya. Okay ang pagtatanong. Magtanong ka doon sa mga hindi bujert. Magtanong ka, mag-careful ka kung kanino ka magtatanong kasi Sa mga budget ka, edi budget din ang ituturo niya sa'yo, okay? Alright, next. Insulin infusion should be administered through the primary IV infusion because of the small volume of IV insulin infusions. For a patient receiving enteral feedings for total parenteral nutrition or TPN, the insulin infusion should be adjusted whenever the feeding or nutrition is adjusted or withheld to decrease the likelihood of hypoglycemia. Typical naman ito, naka-NGT feeding or peg tube feeding or naka-TPN ang pasyente mo tapos may ongoing actrapid infusion. Okay? So, nagta-titrate ka doon in between those infusions. Alright? At kapag may ganon, dalawang high alert, about TPN, saka dito insulin, magkaibang linya po, hindi sila magkasama sa isang infusion pump, sasakalin kita. The goal of insulin infusion for patient with diabetic ketoacidosis for hyperglycemia hyperosmolar state is to normalize the blood glucose level gradually. Titration will vary based on the patient's response, the speed at which the level drops, and facility protocol. Okay? Now, when discontinuing IV infusion therapy, transition protocols are recommended because they are associated with lower morbidity and costs. A patient with type 1 or type 2 diabetes should receive subcutaneous insulin 2 to 4 hours before discontinuing the IV insulin infusion. Ito sa may mga DKA, binibigay muna ng Actrapid or Lantus. Yung Lantus binibigay yan actually ang total infusions niya. Kaya importante na may kanya-kanyang DKA. Huwag ka mag-alala, magdi-discuss natin DKA protocol dito. Now, converting to basal insulin at 60% to 80% of the daily infusion dose has been shown to be effective. Low hematocrit levels can contribute to overestimation of blood glucose values, obscuring hypoglycemia. Lastly, certain medications such as acetaminophen, ascorbic acid, dopamine, and mannitol can interfere with blood glucose meter values. Other medications such as some steroids, antidepressants, and statins, and asthma medication can affect blood glucose levels. Special, dagdag ko lang kapag mag-check ka ng sugar level sa pasyente, ipiprick mo yon hourly. Kung nasaan yung linya ng infusion mo, ba nasa right, hindi ka doon mag-check ng sugar level kasi ipiprick mo yung needles, hindi ba? Doon ka sa left. Kung nasa right, again, kung nasa right yung infusion mo ng insulin, wag ka sa right kumuha ng sugar level, doon ka sa left. Kasi magkakaroon ng false positive result. Maring mas mababa ang makuha mo kasi naandun yung ongoing infusion mo. Doon ka sa opposite side. Malinaw ba yun? Malinaw. Now, let's discuss the complications of your IV insulin infusion. Complications associated with IV insulin administration are the following. Makinig, malapit na tayo matapos. You guys, hinga-hinga ng malalim. Ito na po siya. Mild hypoglycemia. I actually divided this into 3: mild hypogly, severe hypogly, and hypokalemia. Sa mild hypoglycemia, you can expect these following symptoms: tremors, positive shakiness, positive tachycardia, meaning 82 more than a normal pulse rate natin is what? 80 to 100, meaning above 100. You have your anxiety and pallor. That's for your mild hypoglycemia. Signs of your mild hypoglycemia. You also have your severe hypoglycemia, which includes severe cognitive impairment that requires assistance from another person for recovery. According ito doon sa American Association, right? Sila po yung pinagkunan ko ng reference nito, okay? And Lippincott. Next, for hypokalemia, possible with the treatment of diabetic ketoacidosis. What can you expect? Fatal arrhythmias, ventricular fibrillation, and meron dyang possible ventricular tachycardia, VTAC. Alright, once again, these are the complications of your insulin. Kaya very, very, critical. It can cause death. It can put your patient into, into such situation na pwedeng maging at risk yung buhay niya. If you're not gonna handle this one carefully and properly, and you're not mindful of it. Alright? Kung hindi ka sigurado, magtanong ka. Okay? Malapit na tayo matapos sa ating discussion. Promise talaga. Bago ko mag-proceed sa documentation, mag-subscribe ka muna. Kakahiya naman sa'yo. Natuyo na yung laway ko, day. Diba? Thank you so much. Ito na tayo sa documentation. Documentation associated with IV infusion administration includes the following. Ito na. Very straightforward ito. Tuturuan kita kung ano yung mga dapat mong ilagay sa nurse's notes mo. Ito po. Assessment findings before starting the infusion. Patient capillary blood glucose level before starting the infusion. Any bolus medication given. Initial infusion dosage on the medication administration record, including the following: dose, rate, time, route, method of administration, kung peripheral, central line, mga ganun. Next, which device or lumen was used to deliver the insulin infusion if multiple devices or catheter lumens are used? Ano pang dapat mong i-document? Condition and patency of the site before infusion therapy. Subsequent capillary blood glucose levels. Any additional boluses or changes to the infusion dose. Patients respond to treatment. Kung ano bang kita mo sa assessment findings mo after mo mag-start ng infusion. What's this? IV insulin infusion. Any adverse effects, yung mga complications na nakita natin, diniscuss ko kanina, meron ba nun? Ilagay mo sa notes mo. Lastly, teaching, health educations. Teaching provided to the patient and family if applicable. Their understanding of what teaching, any need for follow-up teaching. Alright? So once again, this is your documentation when it comes to starting and doing, receiving, continuing your IV infusion of insulin. Thank you so much, you guys, for watching. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know. If you have other nursing topics that you want us to do, comment it down below. Abangan mo nga i-upload natin this coming Wednesday because it's going to be amazing, fun, and full of education. Full of education, full of knowledge regarding nursing. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, pinakabago, pinaka-fresh, at pinakalibreng nursing review center sa balat ng YouTube. And don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I do have a Facebook page, and this video lecture is going to be uploaded there. Follow me there and subscribe to my channel. What else? I have a podcast channel. It's 3 a.m. conversation with Neil Galve. I talk about life. I've talked about anxiety, mental health. So check the one out because tomorrow, hopefully in God's will, I'll be uploading an episode for all of you guys. So check that one out. And I'll see you again on Wednesday. You have a great week. Have a good one.